Welcome to Gua Sha for Obesity, brought to you by Lamp AccuWellness Foundation, Inc. Overweight and obesity are defined as abnormal or excessive fat accumulation that presents a risk to health. A body mass index or BMI over 25 is considered overweight, and over 30 is obese, or rather it is a state of too much accumulation of triglyceride. Obesity can be caused by hereditary factors, imbalance of metabolism, poor diet and lifestyle, as well as mental factors. Obesity can lead to various pathological changes, as well as a sense of inferiority, agitation, and depression, a psychological illness. Persisting in receiving scraping therapy can produce considerable effects on adjusting body fat, fluid metabolism, and the prevention and treatment of obesity. Recommended procedures: Sen Shu point. Method: use the surface scraping to scrape Sen Shu point on the back from up to down until the skin turns red or Sha speckles take form. Bladder 23. Sen Shu or kidney shu. Location: on the back 1.5 tsun, lateral to the lower border of the spinous process of the second lumbar vertebra. Back shu point of the kidney. Strengthens the kidneys, tonifies kidney yang, nourishes kidney yin and essence, strengthens kidneys' ability to grasp the qi, benefits the ears and bones, strengthens the low back, resolves dampness. Bladder 23 is one of the most effective points to tonify the kidneys. Back shu points are corresponding points on the back where the qi of the respective zangfu organ is infused. If the 5 zang organs are diseased, abnormal reactions appear on the back shu points. Back shu points have a direct therapeutic effect on the diseases of the 5 zang organs. Needling perpendicular insertion 0.5 to 1 tsun. Danzhong point, Zhongwan point, Tianshu point, and Guan Yuan point. Use the angle scraping to gently scrape Danzhong point from up to down until the skin turns red. Then use the surface scraping to gently scrape Zhongwan point on the abdomen from up to down, as well as the surrounding areas of the navel and Tianshu point for 30 times respectively. Finally, scrape Guan Yuan point from up to down until the skin turns red. Ren 17 or conception vessel 17. Danzhong, chest center. On the anterior median line of the chest, at the level of the 4th intercostal space, at the midpoint between the 2 nipples. Front midpoint of the pericardium and converging point of the qi. Opens the chest, tonifies and regulates lung qi, subdues rebellious lung qi, benefits the breasts. Front move points can be used to treat diseases of the affected zangfu organ and those of yang meridians and collaterals. They treat diseases of the 6 fu organs and diseases of yang meridians. An adverse reaction when a front move point is pressed can help make a diagnosis. Needling, subcutaneous insertion 0.3 to 0.5 tsun. Ren 12. Zhong 1. Middle epigastrium. On the anterior median line of the upper abdomen, 4 tsun above the umbilicus. Front move point of the stomach. Converging point of the fu organs. Crossing point of the Ren vessel and small intestine, sanjiao, and stomach meridians. Functions: strengthens and harmonizes the spleen and stomach, resolves dampness, relieves pain. Needling perpendicular insertion 1 to 1.5 tsun. Stomach 25, Tian Shu, celestial pivot. On the middle of the abdomen, Tu Tsun lateral to the umbilicus. Front mu point of the large intestine meridian. Regulates the spleen, stomach, and intestines. Dispels dampness and damp heat. Regulates qi and blood. Needling perpendicular insertion 1 to 1.5 tsun. Do not moxa during pregnancy. Ren 4 or CV4. Quan Huan, gate of origin. On the anterior median line of the lower abdomen, 3 tsun below the umbilicus. Front mu point of the small intestine. Crossing point of the Ren vessel and the 3 yin meridians of the foot. Strengthens, nourishes the kidneys, qi, yin, and yang. Nourishes essence, benefits original qi, calms the sen, benefits menstruation and the uterus. Ren 4 has the function to tonify as well as maintain health. Needling perpendicular insertion 1 to 2 tsun. San Yin Jiao point, Susan Li point, and Fung Lung point. Use the surface scraping to scrape San Yin Jiao point on the inside of the lower limbs and Susan Li point on the outside of the shin from up to down respectively 30 times with a little heavy force. The appearance of Sha is not necessary. Spleen 6, San Yin Jiao, 3 yin intersection. Location on the medial aspect of the lower leg, 3 tsun above the medial malleolus on the posterior border of the medial aspect of the tibia. Crossing point of the spleen, kidney, and liver meridians. Strengthens the spleen and stomach, resolves dampness, harmonizes the liver, strengthens the kidneys, nourishes blood and yin, regulates menstruation, cools and invigorates the blood, benefits urination, calms the sen. Spleen 6 is one of the most commonly used points and one of the most versatile. Because the point crosses the spleen, kidney, and liver meridians, it can treat many conditions associated with all 3 organs. It's an important point in the treatment of any digestive, gynecological, and emotional condition. Stomach 36, Susan Li, leg 3 miles. Location, on the anterior aspect of the lower leg, 3 tsun below stomach 35, 1 finger breadth using the middle finger from the anterior crest of the tibia. Stomach 36 is the Hisi point of the stomach meridian, command point of the abdomen, point of the sea of water and grain. Tonifies qi and blood, harmonizes and strengthens the spleen and stomach, strengthens the body and wei qi, raises yang, calms the sen, activates the meridian, stops pain. Stomach 36 is one of the most important points to tonify qi and blood and promote general wellness. Hisi points are where the qi of the meridian collects and goes deep into the body. Hisi points are known to treat rebellious qi and diarrhea. Needling perpendicular insertion 1 to 2 tsun. Stomach 40, Fung Lung, abundant bulge. On the anterior aspect of the lower leg, 8 tsun superior to the external malleolus, lateral to stomach 38, 2 finger breadths using the middle finger from the anterior crest of the tibia. Lu connecting point of the stomach meridian. Stomach 40 transforms phlegm and dampness, stops cough and wheezing, calms the sen and clears phlegm from the heart, activates the meridian and stops pain. Stomach 40 is known as the phlegm point. It helps resolve phlegm throughout the body. Lu connecting points of 1 meridian can communicate with 2 meridians. They treat diseases of the collaterals and can be used to treat chronic diseases, especially chronic diseases of the Zangfu organs. Clinically, leukonectin points are often combined with Yuan source points in the treatment of diseases. Needling perpendicular insertion 1 to 1.5 zoom. The key to preventing and curing obesity lies in formulating and adhering to correct principles of diet. The arrangement of diet should be based on the situation of different individuals, marked by appropriateness, balance, reasonable structure, and persistence in healthy diet. The time and amount of free meals should be set, and that the speed of eating should be brought under control. Eat less for the supper and don't eat late at night. Exert control over the intake of total energy, particularly the intake of fat. Reduction of energy must be based on principle of ensuring the normal activities of the human body. Generally, the intake of energy for an adult should be around 4,184 kilojoules or 1,007 kilocalories every day. Eat light food. Take enough protein. Eat more assorted grains, rich in dietary fibers, as well as fresh vegetables and fruits, rich in vitamins and mineral substances. Thank you very much for your attention and see you on our next videos.